Hi everyone, my name is Kayla Keeney, and this week I am doing osteoporosis. The disease processes in the body as one begins to age. The density of the bones start to decrease and not be as strong as they used to be. The pathophysiology is bones have multiple components, keeping them intact from like tissues and cells, fibers, and salts. When osteoporosis occurs, the bones break down and become less dense, causing it for a risk of fractures. The bone is not able to reform itself and becomes brittle over time. So I made this diagram. It shows osteopenia can turn into osteoporosis. So breaking down bones over time can cause osteo. Risk factors are age. The older you are, the more at risk. Genetics, if this runs in your family, you're more at risk at getting it. Mobility, if you're not moving around, the bones are starting to become not as strong. So if you're like bedbound, it's very difficult. Alcohol can cause bones to break over time. Smoking. Women are at a higher risk just because of changes in the body, with menopause occurring. Hormones, especially if you're taking steroids like prednisone. This puts you at risk. And low vitamin D intake, not able to help repair the bones if you're not having it in your diet. Major signs and symptoms. So the picture that is displayed by the spine and pain clinics of North America on the left-hand side shows like the healthy bones with like a normal vertebrae, the bone structure, and then one that is the osteoporotic bones as well. The vertebrae isn't straight, it's curved, and how you could tell with the bones and what's inside of them, how it looks differently. But the major signs and symptoms are pain. The patient could be at risk for fractures if they had a fall, they fracture their leg, and now they're in a lot of pain. Changes in height, the bones are decreasing in size. I see this all the time. I always ask my patients, "Oh, how tall are you?" And they're like, "Oh, I used to be 6 feet, but now I'm 5'9" or 5'10". Changes in the spine, the bone in the back can have osteoporosis. That can lead to issues like scoliosis, for example. Fractures, the bones are very brittle and can experience broken bones. Changes in mobility, the patient can have issues depending on how bad the fractures are because of the osteoporosis. Somebody can be independent, have a fall, fracture their leg, and now has to use a walker the rest of their life. Diagnostic testing, you could do a bone density scan. This is very common. This is like the go-to method, which can show how the bones are and if they're very brittle or they're very strong. An X-ray can show like any breaks. A CAT scan, labs like somebody's H&H, see if they're anemic or not, their renal function, their vitamin D, their thyroid, and again, any hormones abnormalities. And that is my presentation. I hope all of you enjoyed learning something about this. This topic was very interesting. But yeah, thank you so much.